Assalamualaikum and selamat sejahtera. I bid to our respected lecturer Dr. Nalina and to our fellow friends. We are from Group 4. Today, we are going to present about myasthenia gravis. This is our group member. What is myasthenia gravis? It is characterized by weakness and rapid fatigue of any of the muscle under voluntary control. It relatively uncommon disease with a prevalence of about 14 cases per 100,000. Next, etiology. What causes myasthenia gravis? According to the Muscular Dystrophy Association (MDA), the exact cause of autoimmune disease like myasthenia gravis is unknown. It is also not inherited and not contagious. It then may be triggered by a combination of irregular antibodies or problem with the thymus gland. First is antibodies. Autoimmune disorder occur when our immune system mistakenly attack healthy tissue. In MG, antibodies, which are protein that usually attack foreign and harmful substances, attack the nerve cell. The antibody block, alter or destroy the receptor for acetylcholine at the neuromuscular junction, which is a crucial substance for communication between nerve cells and muscle. Then, it results in muscle weakness. Next, in people with MG, the thymus gland is abnormally large. It also possible to develop benign or cancerous tumor, which may interfere with important immune cell production. It also produces antibody that block acetylcholine. People with MG can also have tumor called thymomas.
Now, let's take a look on pathophysiology. Firstly is symptoms of myasthenia gravis. The main symptom of this disease is weakness of the voluntary muscle. Voluntary muscle is the muscle that can be controlled by ourselves. Moreover, the failure of muscle to contract usually happens because muscle do not respond to nerve impulse and this cause weakness. Next is the symptoms according to the body parts, which are eyes, face, throat, chest, arm and legs. There are various symptoms according to different body parts. As example, for eyes part, the patient will have the blurry vision and dropping of the eyelids. Then for the face part, they will having the facial paralysis, which lead to changes of facial expression. For throat part, patient will having hoarse voice and difficult to talk. Moreover, they also difficult to swallow and chew. Next, for chest part, patient will having respiratory failure which caused by the weakness of diaphragm and chest muscle. Last but not least is arm and leg part, which they become fatigued plus having a weakness in arms, fingers and leg. Therefore, they having problem to walking upstairs or lifting object. For your information, degree of muscle weakness can change from day to day and the severity of symptoms become increased if left untreated. Next, the clinical findings for myasthenia gravis are patients having oculomotor disturbance such as double vision, then oropharyngeal muscle weakness with difficulty to chew and talk, and lastly, limb weakness.
Stages and how it diagnosed. Myasthenia gravis typically divided into 5 main classes: generalized, congenital, ocular, juvenile, and transient neonatal. For generalized, it is a more severe form of the disease and may experience weakness in other muscle groups. It is also develops in about 50 to 80% of those who develop eye symptoms. Patients gradually develop difficulty speaking and problem in chewing and swallowing. Next, congenital differs from other forms of MG because it is caused by a genetic defect rather than an abnormal immune system response. It is usually inherited in an autosomal recessive pattern. Juvenile myasthenia gravis is commonly seen in children and adolescents. It usually begins before the age of 18 and requires lifelong management. For ocular, the muscles controlling eye and eyelid movement remain the only muscles affected. In transient neonatal, the mother's autoantibodies can be transferred to her baby during pregnancy. Myasthenia gravis also can be divided into several subclasses, which is Class 1, Class 2, Class 2A, Class 2B, Class 3, Class 3A, Class 3B, Class 4, Class 4A, Class 4B, and last, Class 5.
Next is still in pathophysiology, which is self-nutrition assessment. There are 5 components in this assessment, which are anthropometry, biochemistry, clinical, dietary, and environment. First, we will look at anthropometry, and the method that is to assess body composition changes for myasthenia gravis discussed in this video is dual energy X-ray absorptiometry. Because of its precision, the International Society for Clinical Densitometry recommends this method. Based on this one study, this DSA method evaluated several parameters. It is recorded that patients with myasthenia gravis had higher body composition but lower in muscle mass percentage than patients without myasthenia gravis. Second is biochemistry. There are 3 lab investigations to conduct for this biochemistry step. First is acetylcholine receptor test, which the objective is to detect and measure the level of AChR antibodies in blood. So, for myasthenia gravis patients, they will get the result higher than normal people. Second is repetitive nerve stimulation in the electromyography laboratory. Last but not least is hydrophonium chloride test. It is reversible inhibitor for acetylcholinesterase. Tensilon is administered intravenously into vein, and myasthenia gravis patients' muscle will improve immediately. Moving on, clinical. In this component, patient clinical history, physical examination, and medication are being overviewed. Healthcare professionals will ask a series of questions about history of getting any symptoms and also regarding family history. Next, they will conduct a physical examination and check for other indications of myasthenia gravis in severe exacerbation of myasthenia gravis. For example, their reflexes and sight. Physical tests will include aspect tests, blood analysis, repetitive nerve stimulation, and pulmonary function tests. For medication, potential drug-nutrient interaction and nutrition-related side effects should be investigated in a patient's prescription drugs. There are many types of drugs that can influence myasthenia gravis patients. Penicillamine and interferons are examples of medicine that can cause de novo myasthenia gravis by disrupting immune homeostasis processes that prevent the onset of myasthenia gravis. Other medications including antibiotics, anesthetic, impair neuromuscular transmission, resulting in greater weakness in people with myasthenia gravis. Furthermore, dietary. The quantification of food intake is one of the key approaches to assessing nutritional risk in individual patients. There are numerous standardized methods of measuring food intake such as 24-hour food recall, food frequency questionnaires, and direct observation. Last but not least, environment should also be observed in nutrition assessment. It is based on the perception of well-being in different domains. Smoking, obesity, physical inactivity, and insufficient diet all potentially have effect on myasthenia gravis.
Acetylcholinesterase inhibitors, the first-line therapy of MG, is not a cure, but they can improve muscle contraction and muscle strength in some people. However, some patients may require higher doses because their effectiveness depends on the type of autoantibody that causes them. When acetylcholinesterase inhibitors do not adequately relieve weakness and fatigue, the second-line drugs for MG are corticosteroids, which are used to reduce swelling. Oral or injected prednisone are given in high doses that are steadily decreased to a maintenance dose over time. Immunosuppressants are the next step if corticosteroids are not effective or their side effects are intolerable. Prescribed doses of immunosuppressants work in different ways to either reduce the number of immune cells or prevent them from producing autoantibodies. The following therapies are usually used in the short term to treat a sudden worsening of symptoms or before surgery or other therapies. Plasmapheresis uses a filtering process similar to dialysis. The red blood cells are combined with new plasma without harmful antibodies, and the blood is returned to the patient. Once attached with monoclonal antibodies, they either stop lymphocytes from growing or block chemical activities at the neuromuscular junction that provoke the autoimmune processes. Intravenous immunoglobulin (IVIG) provides the body with normal antibodies that alter the response of the immune system. Benefits usually appear can last 3 to 6 weeks and cause few mild side effects. Thymectomy is a type of surgery that is done by removing thymus through a small incision in the chest. The purpose of a thymectomy is to eliminate the cause of the abnormal antibody production that causes the disease and eliminate the symptoms. Although complications are uncommon, they do exist.
Nutrition and lifestyle management. MG patients must follow the guideline in order to get better. How can you make it easier to get nutrients that your body needs? You have to make some changes too. First, the foods you choose. Second, how you prepare foods. Third, the way you chew. Fourth, how you sit when you eat meals and snacks. And lastly, when you plan your meals. So, what can MG patients eat? First, choose softer foods. Foods with softer textures are easier to chew and swallow. Try mashed, soft or pureed foods. Finely chopped meat, veggies or chicken, moistened foods, and avoid dry, crunchy or chewy snack foods. Second, manage liquids carefully. Water and other liquids can make some food easier to eat. Sip water during meals or snack. Add thickening agent to liquid foods. And be extra careful when you swallow foods that have both liquid and chunks. MG patients can improve their lifestyle by doing: first, avoid extreme. It is important to get enough sleep and to take care of health. You need to manage your stress level. To add, try to limit your outdoor activities when the weather is too hot or too cold. Second, exercise regularly. It is recommending to exercise in short, moderate bursts and scheduling exercise when you have the most energy. You can also work with a personal trainer. Third, conserve energy. Rest is important. Make sure you get the recommended 7 to 8 hours of sleep per night. Schedule demanding activities for the times of day when you typically feel your best.
Diet suggestion. What type of diet is suitable for myasthenia gravis patient? The answer is soft diet. Soft diet is a diet that involves only food that are physically soft, with the goal of reducing or eliminating the need to chew the food. There are several diet tips that MG patients can follow. Firstly, choose chicken or fish instead of tougher meat. This is because it is easier to chew. Myasthenia gravis can cause muscle weakness in your jaws and throat, which could make it hard to chew or swallow food. Next, you can try moistened solid foods with gravy, sauce, broth, butter, mayonnaise, sour cream, or yogurt. Lastly, try to choose soft food to make it easier to follow. Try mashed, soft, or pureed food. For example, canned fish, smoothies, ripe bananas, and soup, which are nutritious food that may be easier for MG patients to eat. Lastly, we will be discussing about the meal planning and suggestions that we have come up for MG patients. So here's are the menu plan of the day that we have come up for MG patients. For breakfast, they can have mashed potato, and for lunch, they can have rice with dory soup. Next, for dinner, they can have chicken porridge, and for snack, they can have banana smoothies or any kind of smoothies that is blend. And for fruits, they can eat banana that have been sliced in small pieces. Remember, it is important to choose soft foods that is easier to chew and swallow. That's all from our group. Thank you very much.